This is the beginning of what we think is a very worthwhile and important collaboration between Archways and County Dublin VEC, and the introduction of a very important, worthwhile evidence-based programme to Ireland.
Archways was established in 2007, and it arose out of work that was originally carried out by Clondalkin Partnership, looking at the needs of children with emotional and behavioural difficulties. And that work arose out of our education working group, and it was teachers saying that in every class there was a percentage of children that they were finding it, because of their behaviour, increasingly difficult to teach, and that behaviour was having a knock-on effect on other children and their capacity to learn. So we decided to ask Maynooth to do a piece of research and find out what was this problem, or to try and get more information about it. And for many of us, it was the first time we'd heard about emotional and behavioural difficulties. The piece of research that was carried out was called In Trouble from Day One, and that was a very sad comment by a mother about her 9-year-old son, and that's what she had to say about him. He'd always been in trouble. The research, I think, for us highlighted the sense of isolation that a lot of parents felt, and almost desperation, because they didn't know what to do, and they didn't know where to turn, and they didn't know how best they might be able to help their children. So after we carried out the research, we decided to have a look and see what kind of programs we might introduce to meet this need. So, Sorry, on the wrong slide. Anyway, to date, initially Archways was set up to support the implementation of the Incredible Years programme, which was the programme that we had identified as being the one most appropriate. And why we looked at the Incredible Years programme was A, because it had an evidence base that went back 30 years. And apart from that, it was a programme that could work with parents themselves, could work with teachers, and could also work with the children. And it could be delivered in a community-based, community-orientated way. So to date, over 5,000 parents have been trained and 2,000 teachers, and 12,000 children have been impacted if you look at the work with parents, and a much greater number if you look at 2,000 teachers multiplied by the number of pupils that they'd have in their classroom. So we're looking at a very large number of people have been involved in the programme. It's now happening in many parts of the country, in Limerick, in Galway, in Cork, in Drogheda, as well as in other parts of Dublin, in particular Ballymun and in Dublin 8. So while originally the mission of Archways was about particularly rolling out Incredible Years, we began to look at why evidence-based programmes were important, and to look at the possibility of introducing other evidence-based programmes. Our experience of Incredible Years has been really positive. We've now carried out 2 randomised controlled trials which show, without any kind of question of a doubt, that these programmes and that it works effectively in an Irish context. So we're now looking at other programmes. So why evidence-based programme? And that first point, that not all programmes are created equally. And it's true, they're not. I mean, different programmes, not only do they have different effects, but what we now know is that some programmes actually have a negative effect. That programmes that people put a lot of effort into delivering can have the reverse effect. Our experience with evidence-based programmes came first in relation to Incredible Years, and we found the Blueprints programme. And just to say a little bit about that, the Blueprints programme was a programme that was established in America after the Columbine massacre, when people were asking themselves, how did something like this happen to young people in our communities? How did they end up doing something like this? And what about the programmes that were running? Could they not have stopped it or changed it or had some level of impact on it? So the government commissioned the University of Colorado to look at every programme throughout the US that was funded either state-wise or federally, to see whether they worked or not. And they looked at a number of different things. They looked at the level of research that there was in relation to the programme. They looked at the results from the programme and over quite a long period of time. And they also looked at value for money and whether these programmes could be replicated in other places. So it wasn't enough that it could happen in New York, it had to be able to happen in other types of communities and in other types of settings. And of all those programmes that they looked at, and the Blueprints book is kind of bigger than a Bible, it's about this size, they have only identified 11 what they call model programmes, so 11 programmes that meet all these criteria, and 19 promising Blueprints programme. And Dr. Bry's programme is one of those promising Blueprints programmes. So, as I say, that was our introduction to evidence-based programmes and why we got involved. As I say, these programmes work, and we know they work. They also provide a different way of working with young people, which I think is important. They give staff new tools in terms of the work they do with young people, and they provide a framework from which to operate. People get quality feedback on how they're doing and how the programme is impacting on the young people that they're involved with. The programmes are outcome focused. They look at and measure change. It isn't enough that people are enjoying what they're doing or that you think that young people are getting something from it. It's really important that we know that they've had the kind of impact that we wanted them to have. We often tend to think in community work and youth work that it's difficult or even impossible to measure what we do, but I think the value of these programmes is they give us objective measures so that we can see that what we do is having the kind of effect that we wanted and the impact that we wanted. And they get results, and the proof has been gathered, as I say, over a long period of time, over 30 years about these programmes. And different programmes have been measured according to, under different headings, but we know that they reduce recidivism, they have a significant impact on emotional and behavioural problems. I mean, to the extent with Incredible Years where we can demonstrate that it brings children from a clinical level to a normal level. They've been shown to reduce alcohol and drug use. They have also demonstrated that early intervention, which I think is something that we all know works, that if you intervene early in a child's life, not only do you save or do you support them and make change in their lives, but you also save money. So it's a cheap, effective way to work. And these programmes are all early intervention programmes. So moving on to the MAP programme and why in particular we chose that programme. Early school leaving continues to be a major challenge for all of us, particularly in the most disadvantaged areas. And while a lot of progress has been made over the last 10 years, we still know that the schools in the most disadvantaged areas are way behind the national average in terms of school completion. We also know that the transition from primary to post-primary is one of the real flashpoints. The kids that have managed to do reasonably well in the primary school system with support from teachers have a lot of difficulty transferring to second level. That's not anything that the second level schools are doing wrong, but it's the different environment that they're placed in and the different demands of that environment, dealing with a large number of teachers, dealing with a different kind of curriculum. And that's the point that a lot of children begin to fall through the system. So this programme, in terms of how we're going to use it, will be a transition programme. It focuses on personal efficacy. So basically, and Dr. Bry will talk about this more, it helps young people to become more effective in what they do and how they do it. It's been shown to lead to higher grades at school, to less absenteeism, less self-reported drug and alcohol